Ohio's Republican Governor Mike DeWine was also able to get his hands on some tests, enough to start testing all staff and prisoners in Ohio State correctional facilities. It is a good idea to test people in facilities like that, just like it's a good idea to test all patients and all staff in places like nursing homes and long-term care facilities. Ohio Governor Mike DeWine has been able to line up enough tests to do that in Ohio State prisons. That effort has resulted in what we now know in what is now the largest known outbreak of any kind in the United States. An outbreak in Ohio surpassing even the size of the Smithfield pork plant in South Dakota. Marion Correctional Institution in Marion, Ohio, is now reporting more than 1,800 coronavirus cases among prisoners, and more than 100 cases among staff at that prison. That means that nearly 3/4 of all the prisoners in that one state prison are known to be positive. They are now deploying the National Guard to go help at that facility in Ohio. But, you know, there's nothing that sets apart the Marion Correctional Institution from every other prison of its kind. I mean, the more they test, the more they're going to find. Now, as I said, Ohio is now doing this widespread testing in its prisons. In addition to the Marion Correctional Institution, which has what we believe is the largest outbreak in the United States, that same prison system is now reporting more than 1,000 cases among prisoners and staff at a different Ohio prison called Pickaway. They're also reporting almost 150 cases among prisoners and staff at a prison hospital called the Franklin Medical Center. You'd think if there was one type of state correctional institution that could potentially handle this sort of thing, it would be a correctional hospital facility, but they've got more than 150 cases. Where you test, you find incredible prevalence. And America's original sin in terms of the way we've responded to this epidemic is that we have never had widespread testing. Still to this day, it's spotty. It's where people have connections. But still, with our lack of access to testing, what we know of is 772,000 confirmed cases in the United States of America and more than 41,000 dead Americans already. But that's with terrible access to testing. Everywhere people can finagle enough tests to do widespread testing, they are finding way more cases than they thought possible. Among homeless people at a Boston homeless shelter, among women turning up to give birth at a New York City hospital, among the general public in Santa Clara County, California, among the general public in Los Angeles, with just today reported results of a large general public screening today. In all of these places, you are finding much higher prevalence than the people who were doing these studies and doing these screenings expected before they started doing the tests. I mean, we've now got more than 40,000 Americans dead. We've got new outbreaks almost every day, including of hundreds of cases, right, in rural states, far from the coasts, both in workplaces and in places like prisons. Anywhere people are being tested, we are turning up large numbers, unexpectedly high numbers of Americans who turn out to be positive. And if you've got testing, it ultimately, depends on whether your governor's wife speaks some Korean, right? Or if you've got some other kind of lucky connection that gives you access to tests. The testing is still absolutely hopscotch all over the country in terms of who's got access to it and who doesn't.